Good day, class. In this video, we are going to study the angina pectoris. Angina pectoris is a medical term for chest pain or discomfort due to coronary heart diseases. The coronary vessels, especially the coronary arteries, are important vessels to provide the blood supply or the oxygen supply to the heart muscles. So once something happens to these arteries, patient may result in lack of blood supply to the muscles and result in pain. So the main cause of angina is one or more of the heart arteries is narrowed or even blocked. So these will result in angina or even acute myocardial infarction. When does angina occur? When we answer this question, we need to think in two aspects. As we mentioned, that's the coronary arteries. These arteries supply the blood or the oxygens to the muscles of the heart. So when we consider this situation, there are two aspects we need to consider. One is the blood supply. The second is the consumption or the need of the blood or the oxygen. So either the reduce of the blood supply or the increase need of the oxygen of the heart. So that may the possible reason or when does it happen, it may due to when there's lack of blood supply, such as the narrowing of the blood vessels. It may due to different causes, such as the fat accumulation from the artery walls. So it's narrow the artery, will reduce the blood supply. But in the meantime, if the patient perform physical activities or have heavier workload or strong emotions such as angry or fighting with others, in these situations, they may increase the need of the oxygen or the blood supply. That may result in angina. So in this situation, the patient may present as chest pain or in mild condition, or in some other situation we will discuss later. For example, in a diabetes patient, the patient may present only discomfort, not even pain. So this is something we need to be careful. And in a worse situation, if the vessel or the artery is fully blocked, it will result in emergency myocardial infarction. This may result in the blood supplies in the muscles of the heart. Because of these two diseases, the patient may present, although there are some key differences between these two diseases, the angina pectoris and the acute myocardial infarction. Although there are some key differences between angina and myocardial infarction, it is very important for us to identify or to differentiate these two diseases. These two diseases will have very different prognosis. The common symptoms of angina pectoris described as squeezing, pressure, heaviness, tightness, or pain in the chest. Apart from these, some patients also may present as burning sensation on the chest. Some other patients also may present, the pain also may radiate to the arm, especially the left arm, the neck, the jaw, or the shoulder, or even the back. So it depends on the individuals. It also depends on the severity of the disease. So it depends on the individuals. It also depends on the severity of the disease. The patient may present as different symptoms. That's also why in the practice, sometimes we need to be careful. We need to think about the risk factors of individuals, especially if the patient doesn't present as typical symptoms of angina. For example, this patient doesn't present as chest pain, but in the meantime, the patient presents as toothache, or pain in the shoulder, or the pain in the arm. Apart from the treatments that we can consider from B pain syndrome, or the neck problem, or the toothache, we need to consider, or we need to exclude the possibility of angina. So that sometimes we need to be careful in the clinical practice. Because in this situation, the patient come to you may because of toothache. That's also one of the reasons that's why sometimes the heart attack, the patient suffer from heart attack, but they go to the dentist. So this, especially for those symptoms that are not typical, we need to be careful. Sometimes the patient also may present or accompanied with other symptoms such as dizziness, fatigue, nausea, shortness of breath, sweating. These may or may not, it will depend on individuals and also the severity of the disease. In general, angina can be categorized into two different categories, stable angina and unstable angina. There are some characteristics of stable angina. The most typical symptoms that we need to study from the 5 different aspects, but also how to diagnose from the clinic. So from the symptoms, firstly, the location. Second, the duration, the nature of the pain, the cause of the pain, or the cause of the onset, and also the reason for relieving, how it was relieved. So these 5 aspects. The location, we're going to memorize or understand from these 5 aspects for angina. Also, in the next video, we are going to introduce the heart attack and myocardial infarction. We're also going to understand for these 5 categories. Location of the pain, duration of the pain, nature of the pain, cause of onset, and how to relieve, reason for relieving. So for the typical stable angina, the location, the patient will describe this pain is right behind the sternum. The size of the pain is similar to the size of the patient's palm. The size is similar to the size of the palm. And the location is behind the sternum. The duration, this pain may last for a few minutes, but only a few minutes, a very short time. It won't last long. It won't last more than 10 minutes or even 5 minutes. If more than 5 minutes or 10 minutes, you need to have a further examination to exclude other diseases. The nature of the pain, the patient may present as what we described just now, squeezing, burning sensation, heaviness, or sometimes only discomfort. The causes of the pain, the patient may suffer from this pain after work harder, so such as they lift heavy boxes, they move something, they walk upstairs, or they fight with others, angry, emotion. So all these activities or emotions that will increase the need of the oxygen supply for the heart. How to relieve? In the stable angina, the symptom or the pain can be relieved by resting or relieved by by remove the cause of the diseases. If the patient suffer from angina because of fighting with others, once they stop, the pain relief. If the patient presents with this pain because of walking upstairs, once they stop and rest, the pain disappeared. So these 5 different aspects are very important to diagnose for clinical diagnosis. To confirm the diagnosis, we need to do the examinations, but in the clinics, the first initial diagnosis will be based on the symptoms. These 5 aspects that we need to consider: location, duration, nature, causes, and how to relieve. There's another reason for relieving, the pain relieving. It might be relief due to taking the medication. So this is also different from the unstable angina. The unstable angina the pain may still exist even after taking the medicine. The unstable angina, as described in the stable angina, it may occur when the oxygen needs or the blood supply need of the heart increases. So after walking upstairs, running, physical exercises may trigger the onset of angina. But for unstable angina, the patient may suffer from the pain even when resting. The pain may be worse, more severe, may last longer. It may not disappear after resting or taking medicine. So sometimes the unstable angina may develop into severe condition, which is a heart attack, or in the medical term, the myocardial infarction. So these are something we need to differentiate the differences between these two, because these two will determine your management of the patient. It may affect the treatment principles from acupuncture. Some other risk factors that we need to consider, such as the tobacco use, diabetes, high blood pressure, cholesterol, the history of heart diseases, the age, lack of exercise, obesity, especially the diabetes. Sometimes the patient suffer from diabetes. They may not present with typical symptoms of angina, which is the pain in the chest or the pain behind the sternum. The patient may have no pain or only mild discomfort in the chest. So in this situation, we need to be careful. Sometimes the situation is much worse than the presentation. That's why we need the examinations, either the physical examinations or the blood test or the images. The coronary heart diseases, they won't happen without a cause or without risk factors. That's why we need to know these risk factors. The more risk factors the patient have, the more likely they suffer from coronary heart diseases. In the meantime, once they were diagnosed as coronary heart diseases, even with your treatments, you can relieve the pain, but you need to educate the patient from these aspects to reduce or to limit the risk factors, stop smoking, to control the blood sugar, to control the blood pressure, to keep the cholesterol under control, exercise to lose weight. These are something from the lifestyle or the management of other diseases that can help the patient to prevent the second attack. Common signs or symptoms of a heart attack. This heart attack refers to the myocardial infarction, so the blockage. The patient may present as pressure, burning sensation, fullness, or squeezing pain in the center of the chest, that's right behind the sternum. It lasts much longer, 10 minutes, 20 minutes, 30 minutes, even longer. So the pain could not be relieved by resting or taking medicine. The pain extending to the chest may radiate to the shoulder, arm, back, or the teeth. So this is very similar to a stable angina. But the difference is the duration is much longer. The pain is also severe, increased episodes of chest pain, more frequent. The patient may accompany with nausea or vomiting, shortness of breath, sweating, fainting, or even death. So it depends on the severity of the situation. When you understand these aspects, you're also going to understand from the five different aspects: the location, duration, nature, causes, and how to relieve. So that's the most fundamental elements you need to memorize in angina. Whenever you diagnose, if you see a patient presents with chest pain, or rather use the other words pain in the chest, it's just in general. Or even though this patient is not angina, you also need to differentiate from these five aspects. For example, if a patient says they got pain in the chest for 1 month, constantly pain for 1 month, then you can exclude angina because that doesn't match the manifestation of the duration. If the pain is in the right upper chest, you can exclude, or the patient is not likely to have chest angina because the location is not matching. The nature of the disease, how to relieve. Sometimes the patient tell you if they feel pain when they are sitting, when they are resting to watch TV, they feel pain. But when they do physical exercise, the pain is better. The pain feels relieved. So in this situation, you also can exclude the angina because this is the opposite to what we describe all the causes of angina, the increased oxygen need of the heart. After exercising, the patient feel better. For angina, the patient will feel worse after exercising because after exercising, especially the physical exercise, they will need more blood supply, more oxygen to the heart. The patient will present worse. So these are 5 key aspects that you need to differentiate a patient from clinic. The initial diagnosis. Although even if the patient's presentations are matching these 5 aspects, you cannot diagnose heart attack or angina from you cannot confirm the diagnosis. You need to have a further examinations. You need to send them to the hospital, or you prescribe some examinations that can help you to diagnose. So these are the initial clinical diagnosis. To confirm diagnosis, you need to have further examinations. Some examinations that you can consider, such as the fecal examinations, specifically related to the heart. Some blood tests, such as the chest pain profile, and all these blood tests, especially the second one. The second and the third, actually. These, if you suspect that the patient accompanied with the heart failure, you can prescribe BMP. This also can reflect the heart failure. For heart attack or angina or the unstable angina, the disease may be progressing. So for now, when you test the blood, it might be normal, but because the disease is progressing, So after a few hours, you may need to test the blood again. If you see the changes in the reading of these can reflect the progress of the disease. Or after the second day, you need to retest again after the third day to see if this problem is, if the angina is stable or not. This is very important to monitor the developments of the disease. ECG also very important. This also should be the one of the first examination you need to do. So if you suspect this patient suffer from heart attack, ECG also need to be done for several times. It depends on the situation. It might be need to done after a few minutes or a few hours. And then you also may, in this situation, we do not treat the patient in our clinic. You have to send them to emergencies. In this video, we use a very short time to introduce the brief background of angina. It is very important for us to understand the two categories of angina, the stable and unstable, the differences between these two angina. In the next videos, we're going to introduce the treatments as well as the management of this disease. Thank you for your attention.